Ryan Vaughn. I'm practicing in Schaumburg, Illinois and Rockford, Illinois. My practice is exclusively dedicated to treating patients with nasal, sinus, and headache conditions. In that, we treat a large number of patients who have chronic rhinitis. I'd say maybe 30% of our patients come in with a complaint that includes something along the lines of chronic rhinitis. Probably 70% of our patients, we see findings on endoscopy that would support that this is a chronic rhinitis patient. I've been treating this patient for about 10 to 15 years. She's had a myriad of conditions. Started first with allergies, some nasal congestion, recurring sinus infections. And then through all of that, she started really having symptomatic nasal, runny nose, postnasal drip, nasal congestion that seemed to get worse and wasn't entirely responsive to allergy sprays. When a patient comes in to see me, we'll always assess the severity of their symptoms, trying to figure out how much does this impact their quality of life. There are studies that show that chronic rhinitis can actually have a greater impact on someone's quality of life than a diagnosis of diabetes or even depression. And so what that brings to me is these are not subtle things. Someone may choose to put up with it, but it has a dramatic impact on their day-to-day decision-making, what they're deciding to do, what they're deciding to not do. Maybe they're not going to dinner with friends because they're worried that their nose is too runny. These are all things that absolutely, when left untreated, are risk factors for isolation. Isolation is a risk factor for depression and dementia. This patient had responded really well to a spray. And on nasal endoscopy, I was seeing that there was a lot of excess mucus. And the two combined together have shown me that these are patients that really do well with a NeuroMark treatment. I recommend NeuroMark actually pretty frequently. It's a procedure where there's very little downside, there's very little risk, and there's actually huge upside. In a patient who suffers from vasomotor rhinitis, non-allergic rhinitis, allergic rhinitis, all of those conditions have a component where the NeuroMark procedure helps to improve their overall outcome when we complete treatment. Everyone who comes in is first put on medical management if they haven't already done so. And if they demonstrate that they can't be adequately controlled with medications alone, then when we design a procedure for what needs to be done, I thoughtfully will include NeuroMark for all of those conditions. When we do a NeuroMark procedure with a patient under local anesthesia, they'll come into the office and they're given the option of staying wide awake, or we can give them some medications to relax them so that they feel a little sleepy. The next thing that happens is there will be a spray that is applied inside of the nose to help in the numbing. So about 10 minutes later, we'll apply cotton inside the nose that is saturated with more numbing medication, and it's placed over the site where the NeuroMark treatment will be done. That process usually takes about 15 minutes or so. Once we're at that point where everything is numb, we're then able to do the NeuroMark procedure where we use an endoscope to guide it into place. And the procedure itself takes anywhere from 5 to 15 minutes. With any procedure, there's going to be some risks. And we decided to actually proceed with NeuroMark because it's very low energy, a very safe procedure. And in my hands, I've had a ton of success without any complications such as excessive bleeding. And she's had really nice results. Not only is she breathing better through her nose, but on an endoscopy, we're seeing that the mucosa, the lining, the skin of the nose, if you will, she has a healthier appearance of the nasal lining. She has less wetness, and she certainly is feeling better.